Healthcare policy is drawing less attention this election cycle than other issues like reproductive rights. However, both presidential candidates' views on healthcare costs, access, and elder care will affect millions of Americans beyond the next 4 years. Despite limited media focus, healthcare remains a critical issue for many voters. A recent Gallup poll found that nearly 8 in 10 registered voters said healthcare was either an extremely or very important voting issue this presidential election, with 86% of voters ages 65 and older holding that view. The Gallup poll shows 54% of registered voters trust Vice President Kamala Harris to handle healthcare better, while 44% favor Donald Trump. The Gallup poll found that 96% of registered Democratic voters said Harris would be better on healthcare issues compared with 87% of Republican voters who felt that Trump would do a better job. Independent voters play a significant role in Harris's advantage. 54% believe she would manage healthcare better, while 43% prefer Trump. During his presidency, Donald Trump supported a GOP effort to repeal and replace the Affordable Care Act. This effort was blocked in 2017 when Senator John McCain cast a decisive no vote. The Trump administration took actions critics argued weakened the ACA, which they say led to a 2.3 million increase in uninsured Americans between 2016 and 2019. These actions included cutting the ACA enrollment advertising budget by 90%, ending insurer subsidies for out-of-pocket costs, and expanding short-term health plans that lacked ACA protections. Trump has pledged to replace the ACA again if elected, but he has yet to provide details. In the last presidential debate in September, Trump mentioned having concepts of a plan for repealing the healthcare law.
So just a yes or no, you still do not have a plan?
I have concepts of a plan. I'm not president right now. But if we come up with something, I would only change it if we come up with something that's better and less expensive. And there are concepts and options we have to do that. And you'll be hearing about it in the not too distant future.
Kamala Harris wants to expand and enhance the ACA by permanently enhancing the subsidies in the Inflation Reduction Act, which lowers healthcare premiums via tax credits. The KFF think tank estimates that these subsidies reduce annual premiums by an average of $705 for eligible people. Without extension, the subsidies will expire in 2025. Harris has supported the Biden administration's push for ACA enrollment. More than 21 million people selected a plan between November 2023 and January 2024, resulting in 3.3 million newly insured from 2019 to 2022. In 2020, Trump signed the No Surprises Act, protecting private insurers from unexpected medical bills. He also issued an executive order allowing Medicare to set drug prices based on the lowest prices in similar countries, though legal challenges led to its rescission. The Trump administration implemented a temporary Medicare Part D model to cap insulin costs at $35, which was extended in 2023 by the Inflation Reduction Act. Harris cast the Senate's tie-breaking vote to pass the Inflation Reduction Act in 2022, empowering Medicare to negotiate prices on certain drugs. This act also requires rebates from drug companies if prices rise faster than inflation and caps insulin costs at $35 per month for Medicare beneficiaries. Harris proposes extending the $35 insulin cap and establishing a $2,000 annual out-of-pocket limit on prescription costs for all Americans. Her plan also includes accelerating Medicare's authority to negotiate prices on more drugs. Long-term care is increasingly important as America's elderly population grows rapidly. The number of older Americans increased by over 15 million between 2010 and 2020, according to the Census Bureau. Older Americans and their family caregivers now represent a significant voting bloc, with approximately 48 million Americans providing care to an adult family member or friend, per a joint AARP and S&P Global report. Both Harris and Trump have proposed plans to enhance access to health services at home. Harris recently outlined a plan to extend Medicare to cover in-home care for individuals with cognitive or functional impairments, funded by Medicare savings from negotiated drug prices.
We will expand Medicare to cover home health care for seniors, so more seniors can live at home with dignity, and give more support to the sandwich generation, to those of you who are raising young children and taking care of your parents.
Her plan also includes expanding remote monitoring and telehealth, boosting wages for home care workers, ending Medicaid's estate recovery practice for long-term care services. Trump has suggested shifting resources back to at-home senior care, according to his plan, which includes overturning disincentives that lead to care worker shortages and providing tax credits to support unpaid family caretakers.